Hi, I'm Gabe. I'm the Director of Physical Therapy for Saco Bay Orthopedic and Sports Physical Therapy in South Portland, Maine. The pleasure of working every day with Chris, who's the Director of the Medically Oriented Gym. Chris is going to talk to you a little bit about what we're going to be looking at today.
So I'm Chris Privish, the Director of the MOG here in South Portland. Today we're going to go over some spine safety and some exercises that will help you keep a safe spine and prevent low back pain. So the most important thing we need to do when we're talking about the spine and exercise is maintain stability of the spine. The spine is built with natural curvature. You have curvature in the low back, and it rounds up near the top of the spine here, the thoracic region, and another curvature in the cervical spine. Those curves are there for a reason. That's how your body distributes weight evenly and our mechanics work properly. We've got to maintain these natural curves throughout exercise. When we don't maintain curves, that's when we put excess wear and tear and force onto the discs. And the disc isn't made to absorb a lot of force. So over the course of time, with improper movements or improper exercise, we'll actually wear down the life of a disc with too much rotation, bending, flexing, and twisting. So one of the key exercises we need to do to maintain this stability, we're going to teach is a forward plank. So we're going to have Gabe here start by putting his elbows on the table. We're going to walk his feet back, keep his feet a little closer together, and we're looking to maintain his natural curvatures of his spine while keeping his midsection very tight. At no time should you feel any discomfort in the low back, and we don't want your hips to be too high or drop too low where you have a sway back. In this position, we're going to ask them to keep their chest pushed up and their head in a neutral position staring at the table. And we hold this for an amount of time. The most important thing with core strength is that we build endurance. These muscles have to withstand workload throughout the course of the day. So Gabe would stand here, breathe normally, keep this muscle very strong for a series of time, 20 seconds to a minute. And then at any point in time, if he starts feeling discomfort, he would step forward with one leg and stand up. Nicely done. So Gabe did really well at the inclined forward plank. To make things more difficult, we start lowering him down towards the ground. The closer we are to parallel to the ground, the more his abdominals have to work in stabilizing the spine. So Gabe will show you a proper forward plank on a flat level, where he'll be again on his elbows and toes, making sure to keep his chest pressed up, head neutral, without arching his back. Nice and stable. And we'll watch him shake.
Feels good?
So we're just excellent. The forward plank and being able to control that forward flexion and keeping the spine neutral. Now we're going to work on lateral stability. So we're going to do a side plank. Side plank, we're going to have the patient line up with their elbow on the table. And again, we're going to start on an incline before bringing them down to the floor. Have them walk their feet out. And you're going to take your top leg, step in front so that your heel of your right leg is touching the toe of your left foot. And place your right arm along the side of your body. You're trying to maintain a neutral spine, so a very straight line from the top of your head through your hips down to your feet. And this you're going to hold for a series of time. Let's see if Gabe can do it. Let's see what we got.
Yours look good. Yours look really nice.
Practicing. So heel to toe, head in a neutral position, midsection very tight, without any discomfort in the back.
None.
Perfect. We'd hold for a series of time. If you have any shoulder discomfort in this position, you can also put your hand on your shoulder to help pull in. And again, making sure everything stays nice and aligned.